You tell them what you did.
A GYN oncologist is a cancer surgeon for women, so cancers of the ovaries and the uterus and the cervix. Obviously, every day I deal with the problems of access to care and also patients who are insured but underinsured. I was asked to give you a little vignette about what can happen to a patient who has insurance, has a cancer, has a treatment available, but because of some of the arcane rules that are out there that are not patient-focused, patients can get the short end of the stick, as it were. A patient came to see me about 3 years ago with ovarian cancer. She had moved here from Connecticut. She had been through 7 lines of chemotherapy. She had never really gone into remission, but she continued to fight. She was moving here because her daughter lives in the area. She kind of gave me the sense that she was worried this was the end of the road for her. We were lucky enough to find a relatively new therapy that's commonly used with breast cancer that, believe it or not, actually worked for her. So for about 1.5 years, her cancer steadily got less and less of a problem for her. She started doing better and better. She turned 65. She went from her private insurance to Medicare. The Medicare people called us and said, we're not paying for that. And I said, well, what do you mean you're not going to pay for that? It's the only thing that works for this lady. She's been through every standard chemotherapy agent. We're not out here, just making this up. We have 1.5 years of evidence. They said, sorry, there's a national policy. We know it worked for this patient, but we're not paying for it. I said, okay. We have another treatment, a biological treatment that's twice as expensive. Okay, we'll pay for that. I said, well, why are you going to pay for something that's twice as expensive? It doesn't even make sense. They said, that's the policy. This is what our patients have to deal with all the time. It's not patient-focused. This is a great movement. We need to keep pushing our elected leaders to focus on the individual patients as well as the collective. We need to use our brains and use our resources and work to help people every day. So thank you so much for having me out here.